Our next presenter is Barbara Leach. Barbara is the Special Projects Coordinator at the Family Support Program in the School of Social Work at the University of North Carolina. She focuses on putting family first and at the center, and her professional efforts to address such social issues as behavioral health conditions in children, cultural competence, and racial inequality, while promoting inclusion and self-determination of individuals who have disabilities. Barbara, thank you for joining us today.
Thank you very much for having me. I'm excited to be here amongst so many people who share so many of the same things that I deeply feel about primary care, about access to care, and about human beings really working with other human beings to promote and create good lives for everyone. So I'm with a family support program, which is the University Office of the Family Support Network of North Carolina. Our mission is to promote and provide support for families with children who have special needs, which we define broadly. It includes families with children who have intellectual and developmental disabilities. It includes families with kids who have behavioral health, mental health conditions, and also special healthcare needs, medical needs, and just really families who have children with special needs. So, I need to hold on just a second, and I can now advance my slide. So, the Family Support Network of North Carolina is made up of 12 regional family-driven programs that exist in communities across North Carolina. They are family driven, they are staffed by primarily parents of children with special needs, and they work directly with families. And that many of our programs, at least 7 of those 12 programs, have a NICU presence, so that they are right there with families when they first get a diagnosis or learn that there might be some type of issue going on with their child. So when I was asked to be a part of this panel, I wanted to make sure that the perspective that I'm sharing really resonates with what families are saying right now today about primary care. So I sent out those 3 questions to our Family Support Network affiliates, which includes our North Carolina Family to Family Health Information Center. I sent it out to one of our parent organizations that works with adult children with disabilities, and we also work with our North Carolina Council on Developmental Disabilities. So over the course of 7 days, I got back what actually is more than 22 responses from a cross-section of parents and caregivers, self-advocates, and family advocates. And these are the 3 questions, and here is what they had to say. And so they talked about what primary care means. It doesn't necessarily mean that this is the primary care they get, but this is their understanding of what primary care should be. And let me say, too, that for families with children and youth with special needs, that relationship between their pediatrician or family care physician is one of the most trusted relationships that parents start out with, because they are looking to their primary care physician, their family care doc, to make sure that their children get what they need. So there's a basic level of routine care that they expect from their medical doctor or their healthcare provider, and that is that they will oversee any medical issues, that they are the gatekeepers of information about their child or children, and that if their child has special needs, that they are the ones who would coordinate care amongst their child specialists. That they are also looking for the healthcare provider to provide education and information about their child's conditions and about diseases and anything that families really need to know about what's going on with their children. And they look for them to be able to provide not only those referrals to specialists to help their children, but also to other community resources and supports that they need as a family. They consider their primary care providers to be healthcare advocates, that they will address the whole child and their related issues, be that medical issues, emotional issues, to really help them with educational issues, which is a big issue that families with kids with special needs often face, and that is helping to make sure that their children get a free and appropriate public education and help with life skills. And they expect that their providers will teach them skills that will help them support their child's well-being. So the second question, how can primary care best support children with special needs? And so what respondents said was a team approach is what they would think best serves their families. So that, again, goes back to shared medical records. It is really consulting with other specialists and promoting their child's well-being so that their children will have good outcomes. Co-located services would be really great. That really was something that the respondents said, I think in all of their responses, that going from place to place to get services for their child with special healthcare needs or special needs is really challenging. And that if there was a one-stop shop where their kids' needs could be met, it would really benefit not only the child, but also the family. That healthcare providers really need to learn and educate themselves about our children who have special needs and intellectual and developmental disabilities. As one parent stated, I shouldn't have to be the one to explain common symptoms of my child's disability to his pediatrician. It would be helpful if healthcare providers would take a comprehensive approach of working with their children with disabilities, not just addressing what's happening now, but really looking at and being aware of complications and side effects. They could better support children, all children, by being good listeners, listening to caregiver concerns, and not being dismissive, but being responsive to those concerns, by being flexible with the length of appointments, by being aware that our children have sensory issues, and really if there could be a separate waiting room or some way to accommodate the special needs that children have, that they would partner with parents to address children's educational needs, but also to address all of their children's needs and to address the needs of families, because children don't exist outside of their families. They need training, they need to learn about things like feeding tubes and healthy development And that would be one way that providers in primary care could really help. And last but not least, I think it's really important, this notion that the child is a patient, and so that the primary care provider needs to talk to the child as well as the parent. So recommendations quickly are to train all practice staff on best practices for caring for children and youth with special needs. Using a checklist and being prepared for appointments before you get to that appointment and you have that limited time, so you can address what's really important. Fully engaging the child and the family, as I said before, and communication is key. So adjusting vocabulary so that the family understands, the parent understands, but so that the child also has some understanding of their own condition. And follow through. Follow through with what you said you would do between appointments, so that when parents come back, families come back, they have answers to questions that they've been waiting for since the last appointment. Thank you so much. Families really had a lot to say, and I'd be happy to share all of that with you if it would be helpful. So thank you.